Ladies, gentlemen, Nuffield scholars. Cattle health schemes, what does success look like? This is a question that I first pondered while I was working as a vet in Australia. I was working on JBAS, which is the Johne's Beef Assurance Scheme, and I had lots of farmers coming to me wanting to know what their Johne's disease status was. But when I looked at their farms, I realised that they had other diseases which were circulating in their animals, and they seemed to be causing much more of a problem. And it made me wonder why we prioritise disease control the way that we do, and whether there was a better way to do it. And I feel very fortunate to have been awarded a Nuffield Farming Scholarship to go and study this. And I'm very grateful to my sponsors, the Central Region Farmers Trust, and to my friends, family and colleagues who've supported me on this journey. So before we go any further, what do we mean by cattle health schemes? Well, we don't have to look very far to realise that there are a lot of different types of schemes. Some aim to eradicate or control single-agent diseases such as Johne's disease. Some are more involved with management and environmental factors such as lameness or mastitis. And some disease control schemes are mandatory, such as TB testing. But overall, they aim to improve cattle health. But they've also got other reasons for participation as well. They can provide incentivisation, reduce testing costs, access to higher premiums and specialised markets. But they provide a reassurance and a stamp of high herd health. But what does high herd health really mean? Have a look at these animals. What do you see? They seem happy and healthy, but are they high herd health status? We don't really know just by looking. But looking is a really important part of our assessment. And I had this concept challenge when I visited a dairy farm in Denmark. On paper, they were the highest achievable tier of disease control status. But then I went into their heifer shed, and it was dark, and I could see there were cobwebs indicating that there was poor ventilation. I could smell the ammonia, and these animals I could see were being kept on slats, and they had no bedding, and they had very little lying space. And I could hear them coughing. And I couldn't hand on heart say that I felt that these animals were demonstrating high herd health, regardless of how impressive the paperwork looked. And I saw this time and again on my travels where assessors would come in and they would look at the paperwork, but they wouldn't look at the animals. And to me, that's one of the most important parts. We've got technological solutions. We can manage our animals through data produced remotely. We can monitor our animals from our phones when we're not even in the country. And these are fantastic advancements, and we need to be integrating them into our livestock systems and into our cattle health schemes. And we can use them to streamline the processes and to help reduce the bureaucracy that can sometimes put people off participating in these schemes. But I'm yet to come across any solutions that completely replace good stockmanship. And we risk being blinkered by cattle health schemes if we're using them to label herds as high herd health, just by looking at the paperwork, not by looking at the animals, using the data insights and thinking about animal health and welfare as a whole. Some of you might be aware that some of us went to Zimbabwe. In Zimbabwe, there's a lack of national coordinated disease control. But that's led farmers to take responsibility for the health of their own herds and their own animals. This pig farm that I visited had the highest biosecurity standards of any farm that I visited anywhere in the world. And they had the basics right. They had the right animals for the system, they were focusing on good nutrition, stress reduction, and they had a solid disease prevention strategy, incorporating biosecurity and a tightly executed vaccination programme. It made me wonder, if these farms can achieve high herd health without national coordinated disease control, do we even need cattle health schemes? Which was quite an uncomfortable realisation for someone who was in the middle of travelling the world to study them. But I was reassured by my visit to Norway. Norway have arguably been one of the most successful countries in the world when it comes to cattle health schemes. They've eradicated and controlled lots of different diseases. And I met with this vet, Dag Lindheim. He's been the leading vet on a lot of these programmes. And he talked to me about this concept of cutting the tail. what works for the first 80% doesn't necessarily work for the last 20% of the disease outbreak. We need to coax this last 20% in, taking a different approach with them. And it's easy to think that these might be the recalcitrant farmers who don't want to engage in their industry. But there can be geographical, socio-economic reasons and difficult strains of disease that are preventing people from cutting the tail of the outbreaks in these herds. We need to not brand these farmers as laggards, but take a different approach and work with them and be adaptable to find solutions. This is what's happening with salmonella control in Denmark. In Denmark, there's been a national salmonella control scheme in place since 2002, and the prevalence of the disease has dropped from 25% to 7%. But now it's rising again. So this team of scientists from Exeter, which is the Danish Animal Health Innovation and Research Organisation, have been conducting farm visits, talking to farmers and identifying those barriers that are helping to prevent cut the tail. Often it just requires some simple changes, but it requires a pair of fresh eyes on the situation and to consider the bigger picture. And when we think about the bigger picture, what else do we need to think about? We need to consider the costs as well as the benefits. In 2017, Mycoplasma bovis was discovered in New Zealand. It's a disease that's found in most other countries in the world, but to New Zealand it was alien. It was an exotic disease, and they didn't want it. So they set out on a comprehensive eradication strategy, and it cost the industry $350 million. And it was very successful at eradicating M. bovis from the country. But in the process, some farmers lost everything. Whole herds were culled, farms were left empty, whole farming communities were left angry and traumatised. I talked to Mary Van Andel, who's the Chief Veterinary Officer. She told me how biosecurity and traceability in the country had had an overhaul as a result of M. bovis, and that had had positive impacts on other diseases. But what was the cost? Was it worth it for those farms? It's an extreme example, but it just goes to show that when we're deciding on whether a health scheme is successful or not, it's not black and white, and it depends on which side of the fence you're sitting. Voluntary health schemes provide incentivisation and support to improve animal health. And if they're successful, they can help to provide leverage to implement regulation and compulsory actions, as we're seeing with BVD in this country. And once the disease is under control, it doesn't mean that the health scheme necessarily ends. We need ongoing surveillance. The tail might have been cut, but it still needs monitoring. This is where the work of the World Organization for Animal Health come in. I visited their headquarters in Paris. They estimate that globally 20% of livestock protein is lost to preventable disease. The political, social and economic challenges that are involved in implementing global disease strategies are huge, and they realise that one size doesn't necessarily fit all. So they provide frameworks. They identify clear aims, objectives, milestones and responsibilities. But they take a flexible approach, empowering individual member countries to decide on their own strategies for success. And strong communication, which is facilitated by partnerships, is at the core of what they do. So for cattle health schemes, what does success look like? Success is achieving the aims of the scheme, usually animal health aims, but there are often other benefits as well. And there are some underlying ingredients for success. For governments, having a framework, identifying clear aims, milestones and responsibilities, but having flexibility and being prepared to adapt. For industry, and I would include agricultural organisations, consultants and vets in this, think about the bigger picture. What are those non-animal health factors that influence animal health? Seek win-win solutions that help to streamline the process for everybody. And for farmers, good basics. Cattle health schemes serve both animal health and commercial purposes, but having the basics of nutrition, stress reduction and preventative disease control right helps to create a solid foundation on which to build the health of your herd and your business. But none of this can be achieved in isolation. It requires communication and communication is best facilitated by partnerships. Partnerships at all levels, on farms, between different organisations, and between different countries. And with people who have a diversity of skills and experience, not just people of the same background or gender or culture as us. At the end of each visit, I asked my hosts this question. If you could have or do one thing to improve livestock health in your part of the world, what would it be? I had answers ranging from better regulation of livestock trailers to better global public-private partnerships. And my studies have made me realise that in the UK, we're in an extremely privileged position to have cattle health schemes in the way that we do. We have the skills, the technology and the expertise, not only to be able to achieve animal health, but also to demonstrate that we've achieved animal health. And cattle health schemes provide a pivotal role in driving up standards. So we should take pride in the health of our industry. But we can't rest on our laurels, so I would urge you to consider this question for yourself. If you're involved in animal health in any way, whether through cattle health schemes or not, what is on your wish list and what could help you to achieve it? Go and have those conversations, communicate and create partnerships. Because by identifying clear aims and working together, we can all play a proactive part in making health, wealth and happiness a ruminant reality. Thank you.